Who wants to talk about cancer? Can I interest you in a sit down, a cup of tea, and a chat about cancer? Have you thought about cancer today? Well, you're gonna now. Hi, it's me, it's Abby. Welcome back to my channel. I've been wanting to say that since I started posting on YouTube. I did it. I said it. I've been making this little series about myself. It's the Abby series. It's where I talk about myself and all my issues. It's really light-hearted viewing. I'm a little bit poorly at the moment. It's not related to the cancer. Well, I might be actually. I've got a common cold really, which I might have got because I'm immunosuppressed, but I also might have got because it's January. But I made it to CrossFit this morning, which is good. I woke up, felt dreadful, dragged my butt to the gym. Just getting through the door into the gym at the moment is an achievement. So well done me. So I did a video about all my addiction issues, my problems with drinking. And then I made a video about my borderline personality disorder and all my years of self-loathing. And now I'm going to talk about cancer because that's the third issue that I have. My big three, the big three: addiction, BPD, cancer. Honestly, I was just going about my life. I was, things were looking up. I got into therapy and I was feeling really good about managing my mental health issues. I'd been sober for 4 years, and then all of a sudden the universe or God or whoever's in charge, whoever it is, because it's certainly not me, whoever's in charge just said, you know what? I see that you're really nice and settled now and you're doing quite well. How about a little bit of brain cancer just to balance things out? I see you're doing quite well in life. Here, cancer. So yeah, I'm going to tell you how I got diagnosed with brain cancer at the age of 36. Well, no one really knows where primary brain tumours come from. But just like any cancer, it's just like a genetic mutation. Your cells get all messed up and they mutate and they turn against you. Cancer is when your cells have a meeting that you're not involved in, and then they go, right, shall we just rebel? Shall we just mess everything up? And your cells wreak havoc on your body, and they just, and they're running around and they're throwing things out of place and they're moving things around, and that goes there where it's not supposed to go. And it's like a house party. It's when you have unwanted guests and they ruin all your furniture and they spray paint the walls, and they're like, right, this is a good job, we've done great here. And then they just leave and you're left with the mess. That's what my cells have done to my brain. So I got diagnosed with brain cancer last year in about March, and it was a surprise. It was a shock. Cancer is quite prevalent in my family. Like lots of my family members have dealt with it. My brother's a cancer survivor. My cousin died of it a few years ago. My auntie died of cancer last year. So it's in the genes. But I wasn't expecting to get it myself, because you never do really, do you? Cancer's pretty random. Obviously there's plenty of lifestyle adjustments you can make to lower your chances of cancer, but it's just like the disease kind of just goes around and just plucks people out of the blue, and it's like, right, it's your turn. Here, have some of that malignant mess in your body. Yes, I wasn't expecting to get cancer. I was just picked out of the crowd, I guess. So in this video, I will talk about my symptoms, my treatment so far, and how I'm getting on with my old cancer journey. So we'll rewind, I think, to October 2023, right? That was when I first started getting migraines. I've never really had migraines before. Apart from all of my addiction issues and the absolute hell that I put my body through during that phase of my life, I've always been pretty fit and healthy. I've always had a interest in sport. I love fitness, and I've always, eaten really well, apart from when I was smoking crack and I didn't eat at all. Since I've been sober, I've basically led a very healthy lifestyle. And even up until then, I was always, I'm a sporty gal. So I've always been moving my body in one or another. In October 2023, I'd been sober for like 3.5 years, been leading this like super healthy lifestyle, eating well, exercising loads. Yeah, they're just basically smashing it. But I started to get these migraines, right? But that kind of coincided with me quitting caffeine. Here's the thing, when you get sober and you have a history of addiction issues and you've had substance abuse problems, when you get sober, you usually find another vice. Some people start smoking a lot. Some people like will gamble. Some people will like to have adult fun with other adults. And then that will be their new vice. For me, it was caffeine. Like, I turned into a coffee hound. I'd always like drank coffee, but when I got sober, it just got out of control. Like the amount of caffeine that I was drinking, I was drinking at my worst like 2 liters, 2 liters of Diet Coke a day, coupled with about 12 coffees during the day. Like it was just non-stop. I drank caffeine like I drank alcohol, because that's what happens when you have addiction issues. You just can't do anything in moderation. It's like you find a thing that makes you feel good and you're like, right, I'm going to do this again and again and again until I spoil it for myself. I'm going to do this to the extreme because it's given me a little bit of dopamine and I'm obsessed with that now, and I will just keep on doing this until I get sick. I wasn't really having any like negative side effects actually. Like it wasn't like I was sleeping badly or anything. I think I probably did, like I was quite jittery, and I think I probably had a bit of anxiety due to the caffeine, because that was just like an ungodly amount to be drinking. But you know, I've put my body through worse. But I kind of figured when I got to 12 coffees and 2 liters of Diet Coke a day, I kind of got to the point where I was like, right, this is getting silly now. Like this can't be good for me. Even if I feel fine now, this can't be good for me. I need to think about my future self, and I need to knock this on the head. I need to stop doing this. So I quit caffeine. I just stopped drinking coffee. I quit caffeine in the same way that I quit alcohol. I just went cold turkey. I just stopped overnight. And when I did that with caffeine, I had withdrawal, basically, just like I did with the booze. Like I had withdrawal. When I stopped drinking caffeine, I was getting migraines. I was feeling sick. I was really moody. So those migraines and that kind of like period of withdrawal probably lasted maybe like 2-3 weeks. Then I started feeling better, and I was like, oh, okay, great. That phase has ended now. I'm going to be fine. And then I went into 2024, feeling all right, feeling good. I was like, right, I've gone through caffeine withdrawal. Those headaches, must have just been because of quitting coffee. And then I was just getting on with my life. 2024 was going well. And then about March, the headaches came back, but even worse. They came back with vengeance. With the migraines, it got to a point where I was waking up at 3 o'clock in the morning every day, screaming in pain because my head hurt so much, getting up, vomiting, lying on the sofa, just kind of like trying to, with cold pack on my head, just taking all the medication I could, and just trying to kind of make my way through the pain. And it was pretty much like 3 a.m. without fail, I'd wake up screaming. My partner, Steph, would have to run and get a bowl for me to throw up in. And that was every morning. This would be like an average day in the life of me having my brain tumor symptoms, right? I'd wake up at 3 o'clock in the morning screaming with this like, crushing migraine, throw up, then I'd go sit on the sofa, throw up some more, make my way through the pain. But I would start feeling better about 8 a.m, which was when I would need to start getting ready for work. So I was waking up at 3 a.m, screaming because of my migraine, lying on the sofa until 8 a.m, when I'd start to feel a bit normal again. And then I'd go into work and then do a full day of work in the office. then come home and do it all again. And that was just so incredibly difficult. Like that's no way to live. Up at 3 a.m. every morning with a migraine, going into work, doing a whole work day, coming home, falling asleep straight away, and then doing it all again. Like, I can't express how painful the migraines were. Like, well, they hurt so much that I would throw up. that was how dreadful it was. This period was like one of the most difficult times of my life. Even more so than the brain surgeries and the treatment I'm having now. Like, the symptoms of my brain tumor were, oh god, it was just so difficult living like that. Migraines all the time, throwing up all the time, not having any sleep, but then also trying to hold down my life, trying to like keep all the plates of my life spinning, trying to keep in control, trying to keep my job, trying to still perform, and trying to like keep my life like on track whilst dealing with these really, really difficult health problems. It was just so difficult trying to like keep my life together while dealing with all these health issues. So I'd been to the GP a couple of times, went to go see my doctor a couple of times. The first time, she told me to keep a headache diary. She was like, don't think it's anything to worry about. Just keep a diary whenever you get a migraine. And that way we can track it and we can see what's causing these migraines. And I was like, yeah, okay, cool. I didn't do that. Obviously, I didn't do that. Like, I've got a migraine. I'm not keeping a diary. My life was difficult enough. Like, I'm not keeping a diary over it. So I was like, yeah, I'll do that. Didn't do it. And the migraines persisted. So I went back, and then the doctor said, oh, I think you've got a sinusitis. And I was like, fair play. Because it made sense because I was sick, and with my migraines, I had a little pressure like here, like behind my eyes and where my sinuses are. So I was like, okay, makes sense. So they gave me some antibiotics for that, and I took the antibiotics, and I was feeling a bit better, and then it went back to normal, and then the migraines persisted. So I was just like in and out of the doctor's office, really. I'd feel a bit better, and then I feel worse, and I just kept on going back and being like, these migraines will not stop. And then it got to the point where my vision started to get really blurry, and I had like double vision. So I pretty much like I couldn't focus on anything. I'd walk down the street, and yeah, there'd be double of everything, and then I couldn't, like, if I held something up to my face like this, I'd have to really focus on it like that. And it got to the point where my partner Steph had to kind of take me by the hand and had to guide me everywhere because I couldn't see. Like, I literally couldn't see what was in front of me, like, which obviously rang alarm bells. So I made a appointment with my optician to get my eyes tested. They scanned my eyeballs, and I remember there was two opticians, and they were kind of like, they were looking at the images, and I could hear them whispering to each other. And I heard one of them say, "I'll get Moorfields Eye Hospital" on the phone. And then I was like, eye hospital, Moorfields, like that's not good. And then they called me into another room, and then they showed me the scans, and they were like, right, here's a normal person's eye. The lens of that person's eye was like a clear circle. They were like, this is like a regular eye, and then here's your eye. And they brought up an image of my eye, and my lens, the lens of my eye was just a big blurry mess. It was so cloudy and not crisp and clear. And they said, your optic nerves are really swollen, like really swollen. And they're like, this is a cause for concern. So you need to go to A&E, accident and emergency. They were like, right, you need to go to A&E at the eye hospital right now. I was like, oh, can I go tomorrow? They're like, no, you have to go right now. So I called up my partner. He came and picked me up and took me to the eye hospital, and they were expecting me, and they kind of like took me through to be seen straight away. And then we were there for a couple of hours, and then again I had some more scans, and then then I overheard the eye doctor there. These eye doctors, they're not very subtle. I could hear the eye doctor on the phone, and I kept on hearing him say like neuro, like the neuro team. And I was like, neuro? That's like your head. That's your brain. Like, I don't want to talk to anyone about my brain. It's my eye. But I started like to not worry, but I started to kind of like think like, oh, okay, maybe this is a bit more serious than I thought. So they're talking to brain people. That's a big deal. So the eye doctor was like, right, I've spoken to the neuro team and they want to look at your brain. So they sent us to another hospital. They're like, right, you need to go get a CT scan right away. We need to see what's going on in your brain. It must have been like 10 or 11 by this point, PM. So me and Steph, we went to the other hospital, went to A&E again, went straight through for the CT scan. It was getting quite late, so they gave me a bed in the hospital, and Steph fell asleep in the chair beside me. It was super cute. And then in the morning, they kicked Steph out because he wasn't supposed to be there. It was a women's ward, and you're not supposed to, have people stay over. So they chucked him out in the morning, and he went to work. And then a doctor came round to see me, and he said, I've got the results of your CT scan. And I was like, brilliant, lay it on me, doc. And he was like, yeah, there's something in your brain. There's a mass up there. And I was like, oh, okay. And they were like, yeah, it's a tumour. Like, well, be honest with you, it's a tumour. And I was like, great, thank you. And he said, we can't tell exactly what it is, but there is a chance that it's malignant. Yeah, it doesn't look like it's benign. It looks like a malignant tumour. And I was like, you're a malignant tumour. Let me get out of here. Just kidding. It was weird. Like, I don't know, when you watch like medical dramas and stuff and they tell patients the bad news and stuff, I don't know. I always thought that if I was delivered like bad news, time would slow down and it would like hit me like a ton of bricks and whatever. But it wasn't like that. I don't know. I guess it was just so surreal that it almost didn't feel like it was actually happening. I didn't feel like I was going to like faint or like having a malignant brain tumor is really like shocking news. But I was just like, oh, okay. I always thought if I was given news like that, I'm a very dramatic person. I always thought I'd be like, no, I'd be a very main character about it. But no, I was just like, okay. And then I called Steph and I was like, can you come back to the hospital, please? Got a brain tumour. A couple of hours later, 2 more doctors came around to see me. They were like, hello, we're neurosurgeons. And I was like, oh, hello, neurosurgeons. What do you want? What can I do for you? And they said, you are having brain surgery tomorrow morning. And I was like, oh, what? Am I? I was like, oh, I just went to go get my eye tested. And for some reason, I'm now scheduled to have brain surgery. Yeah, and they said, right, so you've got a tumour in your brain. And then you've also got a cyst. There's a cyst next to the tumour, and the cyst is filling with the liquid and it's getting bigger and bigger and bigger, and it's pushing the tumour into your brain. And that's where all your symptoms have been coming from, really. Not the tumour itself, because the tumour's just been chilling. It was the cyst that was pushing it into my brain. And yeah, so that's what happened. I went in and had brain surgery. I text my work and I said, so I'm not coming in tomorrow because I'm having brain surgery. And I'm probably going to need a little bit of time off. Yeah, so I had the brain surgery, and it all went well. It was good, great. Best brain surgery I've ever had. They did all the things that they wanted to do. Took a little biopsy, and then they drained the cyst. I remember waking up in the recovery room and I was like, Steph, where's Steph? And the nurse next to me was like, what's a Steph? And I was like, he's my boyfriend, where is he? They were like, oh, okay, yes, we'll take you to him. And then they wheeled me down to the recovery room, and Steph was there waiting for me. I was drugged up, but I was so happy to see him, like ecstatic. Yeah, and then the surgeon came around to see me. He said the operation went well, you did really well. It was about a 4-hour operation. They drained the cyst, and the migraines should probably stop now, and etc., etc. And then he said, but one thing did happen, and I was like, ooh, that doesn't sound good. And he said, look, this does happen sometimes, unfortunately, but during the operation, I might have a little bit dropped your skull fragment on the floor. And I was like, you did what now? Luckily, my brain surgeon has quite a similar sense of humor to me. He had a really good sense of humor, and he said to me, yeah, I dropped your skull on the floor, but 3-second rule, so I picked it back up and gave it a wash and just stitched it back on. We're going to put you on some antibiotics, but hopefully you'll be fine. And I was like, yeah, hopefully. And from that moment onward, I nicknamed my neurosurgeon Dr. Butterfingers. Not to his face, only behind his back. Yeah, Dr. Butterfingers was right. Like, my migraines completely stopped. Obviously, when I was recovering from brain surgery, I had a bit of pain, but I was on a lot of painkillers and whatnot. But yeah, the symptoms of my brain tumor basically vanished almost overnight. My eyesight came back after a few days. Migraines lifted, stopped throwing up. Eyesight went back to normal. Fantastic. So I got released from hospital to recover at home, I think 2 days after that surgery. Went back home, and I was like, right, time to rebuild my life while we wait for the results of the biopsy. And yeah, so I just focused on my recovery, really. I spent a lot of time resting. Steph looked after me. I made a lot of content in that time when I was recovering from brain surgery. What else was I going to do with my time? About a week later, we got a phone call from Dr. Butterfingers, and he was like, right, got the results from your biopsy. And I was like, oh, what is it, Butterfingers? And he said, right, so you ready for this? And he was like, no, I'm not ready for this, but you're going to tell me anyway. And he said, so your tumor is malignant. It's definitely cancerous. And it is a lot more aggressive than we first thought. Not the news I wanted to hear. But again, it didn't hit me like a ton of bricks. It just kind of like, I don't know if that's because I've been through a lot of trauma in my life and I can just deal with crises quite well. I'm quite resilient. He told me, he was like, yeah, it's pretty aggressive cancer in your brain there. And I was like, oh, okay, cool. I guess it's just another hurdle, another challenge for me to live with. And he said, you need another brain surgery. In a week's time, we need to remove this tumor because it is bad. It's trying to kill you. And he was like, and I have some more bad news. He said, obviously it's in your brain, so it's very delicate, and there is a chance you might be paralyzed. Dr. Butterfingers, aren't you just the bearer of bad news, you little rascal? He said the aim is to not damage you and to not paralyze you. He said, I'm going to try my hardest not to paralyze you. He said, but the likelihood is that you are going to be in hospital for a few weeks. So my tumor is here on the right. And he said that because they're fiddling around in that part of my brain, it will probably affect my left side of my body. And he said, you will probably have to stay in hospital for a few weeks and learn how to use the left side of your body again. You're going to have to rehab it. And then you'll have to have radiotherapy, and then you'll have to have chemotherapy. And, that was a bit of a blow, actually, because by that point I was just, I'd had my first brain surgery and I'd started recovering from that. And I was starting to feel a bit more normal again. And then bam, have to go in for another brain surgery. So it was a bit of a blow. It was like, oh, I'm going to have to do this whole brain surgery thing again. But you know, I knew what to expect. I'd done it once before, so I was like, right, let's do this, Butterfingers, but don't you dare drop my skull on the floor again. So I went into hospital a couple of days later, and yeah, they did the brain surgery. This time it was, I think, like 7 hours or something. And yeah, the day before the surgery, there were a few tears. I was a bit scared because I didn't know what I was going to wake up to. You can imagine the risk that comes with brain surgery. You don't know if you're going to wake up. But the surgery was a complete success. And I remember when I woke up, the first thing on my mind was, can I move? And I remember lying there and just moving my left arm like this. I was like, right, I need to test if I can move. And I remember like moving my left arm like that, and I was like, oh, thank God, like I'm not paralyzed, like I can move the left hand side of my body, fantastic. And I was just there, just, I don't know, doing these weird little arm exercises. And then Dr. Butterfingers appeared by my bedside, and he was like, hello, it's me, Butterfingers. He was like, I see you can move. And I was like, thumbs up, yes, I can move. And then it was all about starting the process of recovering from brain surgery again. Then over the next couple of days, I saw the occupational therapy team, and yeah, they tested my physical strength. They tested to see if I could walk up and down stairs, if I could walk around the ward. And then they gave me some like cognitive tests to see if my brain was still working, if I could still think in the right way. And then they discharged me 2 days later. It was weird. I was expecting to be in hospital for a long time, and that didn't happen at all. And I told everyone it's because I'm a medical marvel, which I am. Then went back home and began the process of recovering again. So I just gave myself time to heal, rested my body a lot. Loads of friends and family came around to see me. I had lots of visitors, lots of support. Steph looked after me a lot. About 2 weeks after I got home, I started exercising again, did very, very gentle workouts, and then went back to powerlifting when I was strong enough, which was just insane. Like, powerlifting is my favorite thing to do. It's my passion. It's one of the things that gives me more joy than anything else. And I was really worried I'd never be able to do it again. So imagine how happy when I was back squatting again, even though it was just very, very little weight on the bar, just being back in the gym and using my muscles again. Like, I was just over the moon. Like, I was so happy, like to be doing the thing that I thought I would never be able to do again. It was just like, like I cried. I was so happy. And then eventually I had a meeting with my oncology team about further treatment and about like what the state of my cancer was. So going into the hospital to have the meeting, I was a bit like, I don't know, I prepared myself for the worst again. Like, I knew that I had brain cancer, and I knew that the prognosis for brain cancer wasn't particularly great. I knew that like the survival rates of brain cancer can be very short. So I prepared myself to be told that I'd only have about 5 years left to live, even though that wouldn't have been the worst case scenario. Some people are diagnosed with brain cancer and then they only get a few months, but I, for some reason, got into my head, no pun intended, that it was going to be about 5 years. I went to the hospital, had a meeting with the oncology team, and they let me know that, obviously it's impossible to tell how long someone's going to live with cancer, and that, I'm an individual and the data's quite old and there's not really enough research, but said people with oligodendroglioma, it's very, very difficult to say. People with oligodendrogliomas usually live about 15 years. So I was like, oh, that's quite good actually. I thought I'd only have 5 years left to live, but 15, that's all right actually. So for it was really, really hard news to take because I wanted to live until I was really old. I spent a long time growing up and into adulthood, struggling with my mental health and not wanting to be alive at all. But I had gotten to a point where I did actually want to live, and I was really happy in my life. And so to be told that, you know, my life was going to be cut short, was disappointing, I think is the word that I'd use for that. Yeah, it was really disappointing because I want to live until I'm old and grey and saying weird stuff, and you know, I want to be like a rude grandma. I want to be an old grey rude grandma who just goes around talking weird. So being told that your life's going to be cut short is like, you know, it's like, yeah, it's disappointing, really disappointing. But I think I just approached the whole thing with just acceptance. You know, there's very little I can do to control this. All I can do really is keep my body as healthy as possible and turn up to my treatment. And so I've just come to a place, of acceptance. This is what I'm dealing with. These are the cards that I have been dealt in life, and there's nothing I can do to change it. I can just deal with it the best I can, stay positive, try and live a normal life as possible, be responsible with going to my doctor's appointments. And yeah, that's pretty much all I can do in my power. The rest is like, you know, it's not up to me. I can't do anything about it. So I might as well just accept it. And yeah, just live as well as I can with the time I have left. The thing that made me the most sad was the thought of leaving Steph, my partner. That's the thing that, rather than myself passing away, I was more upset about having to leave Steph behind, because I'm gonna cry, because I love him. And I don't even like leaving him in the morning when I go to work. Like I don't want to leave the earth without him. But you know, death is part of life, and it's something we all have in common, and it's something we all have to do. We definitely don't have a say in that. No one has a say. Like, we're all going to have to do it at some point. So I think that also helped me accept my fate, because it's like, this is going to happen one way or another anyway. Like, this is going to happen to me. Like, this just isn't the way I thought or wanted, but you know, whatever. Yeah, and then I started my radiotherapy treatment. I was very lucky to do a clinical trial for my radiotherapy using proton beam therapy instead of the regular photon beam radiotherapy that they usually do. I don't really know what I'm talking about, to be honest, but I do know that the clinical trial I was doing was to see if this type of radiotherapy had less side effects and shorter term side effects than the standard type of radiotherapy. And yeah, so for 6 weeks I had radiation zapped into my brain 5 times a week. It was like having a full-time job, and yeah, I didn't really get that many side effects at all. I was a little bit fatigued, but yeah, no, it was pretty much fine. Like, I didn't really have many side effects. Really, it was just, you know, inconvenient because I had to commute into central London every day. It was very time consuming. And then I started chemotherapy in September, and I'm doing 6 cycles. I've done 3 cycles already. Each cycle is 6 weeks. So I go every 6 weeks, I go into the hospital to do an infusion, where they plug me in and they do the little drip thing that everyone's familiar with. And then I go home, and then I take oral chemotherapy for 10 days. And then after that, I have 32 days of rest. And then I go back into the hospital and start it all again. The first couple of cycles of chemo were fine. Like, I was quite tired, but I didn't really have any side effects. They did warn me, though, that it would get worse with each cycle. And then the 3rd cycle that I had last, I got all the side effects. I was really sick. I was fatigued. I was itchy from head to toe. I had mouth ulcers, the works, basically all apart from hair loss, which on this type of chemotherapy won't really happen. PCV chemotherapy is what I'm doing, and hair loss is not very common. So yeah, apart from hair loss, I had like all the classic chemo side effects. Yeah, and I start my next cycle in 2 weeks' time. I'm a little bit nervous about this one because each one's getting worse, and the last one was pretty gnarly. Like, I was really quite sick during my last cycle. Yeah, so a bit nervous about this one coming up, but you know, I've come this far and I'm doing well. Yeah, and just as I'm going through this treatment, I'm just trying to like live my life as normally as possible. I'm working out when I can. I went to CrossFit this morning. Like, yeah, each day I kind of have to assess how I'm feeling, but I keep staying as active as possible, going to the gym, lifting, doing a lot of indoor cycling. Yeah, I'm basically just trying to live my life as I would usually, but just with a few adjustments here and there depending on my health. You know, mentally I'm doing very well. I think I'm coping very well with it, actually. Like I said before, I think it's just I've had so many crises over my life, and I've gone through so much trauma. Like, I'm just a very, very resilient person due to all the things I've had to overcome in the past. And so obviously this hasn't been easy, but I've successfully overcome so many hard things in my life, and this is just another thing that I know I can do. Like, every time I'm faced with a challenge, miraculously I've been able to overcome it. So this is another one of these things. Even though my cancer one day will, unless I have an accident, my cancer will end my life, but I'm able to live a good quality life until that day comes. Yeah, before this whole cancer debacle happened, this cancer caper, I'd gotten into a really bad habit of being very negative about life. I'm quite a pessimist, to be honest. I'm like, I can be quite bubbly and fun, but also there's a darkness to me, and also I'm just naturally quite pessimistic, quite nihilistic. I'm a bit like, oh, nothing matters, so why care anyway? There's no meaning, there's no purpose of life. Like, I can be a bit like negative in that way. I'm quite a cynical person, but getting cancer has changed that around. I mean, I'm grateful for the mindset shift, but I kind of wish I didn't have to have cancer to get to this point. But I'm a much more optimistic person. I don't take life for granted anymore. I'm very, like, I don't know, like when you get given a timeline, every day has value. Like, every day should have a value anyway, but when your life you have a certain time limit, and you know that your time is coming, basically. When you're given a time limit, everyone has a time limit, but when you know yours is going to be considerably shorter than the average person, yeah, it just brings so much value to your life, because you don't take anything for granted, and you're very, very grateful for each day, each moment, and being with loved ones and all those experiences, you know. And it's a beautiful thing. It's a really beautiful thing. The cancer sucks, but I'm a lot happier, actually. I have a lot more good moods than bad moods these days, because, you know, I'm never one to not validate my emotions. You know, I went through, when I was struggling with addiction, you know, I drank because I didn't want to feel, my feelings were too painful, so I drank them away. But since I've been in recovery, I have learned to manage my feelings, and even the difficult feelings, you know, I don't push them away. I let myself feel them, because I know how detrimental avoiding your emotions can be, and suppressing your emotions can be. So I make sure, if I'm feeling scared or angry or upset, I do make sure that I feel it. Like, I don't push those feelings down. Like, obviously I do feel sometimes like, this is so unfair. Like, why did I have to get cancer? Why has this happened to me? There's an injustice to this. So I do feel angry and resentment and stuff, but I just try not to stay there too long. I honor those difficult feelings, but I don't dwell on them. I don't ruminate on them, because well, I've only got 15 years left to live. I'm not spending those 15 years being angry at my cancer or being angry at my lot in life. I think a victim mindset and being like, oh, self-pitying is not a great place to be. Like it just harbors resentment, really, being like, why? Like, woe is me, poor me, why does this have to happen to me? Like ruminating on those feelings, like it just makes you feel worse. Like self-pity is not a helpful thing to do. It does, like, wallowing kind of like pushes you further down. So I don't do that, or I try not to do that. Anyway, so I've only got 15 years to live, so I better wrap this up because I've got lots of things to do in that time. Anyway, so my videos are going to be weekly now because I say so. And I want to really make a go of this YouTube thing. I will get better at doing it, and I'm going to do some vlogs, and I'm still getting used to talking to camera in this way. But yes, weekly videos is my goal. So join me next week for another exciting installment of Abby Talks About Herself. All right, I love you. Bye.